Hello out there in television land. Welcome to another edition of It's Your Health. After a brutal winter, hopefully spring is sprung. Welcome to the first segment of It's Your Health. We're going to be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things, and I mean any of the things that we talk about here on It's Your Health. Remember, it's Your Health, your leader in healthcare information. We'll be right back. Welcome to It's Your Health once again. I'm here with the Fipster, my son in charge of things today. He's going to be the master of information, and we're going to start right off, right?
All right, let's start with some headlines. FDA warns of seizures when mixing Chantix with alcohol.
Well, you know, Chantix, I think it's a great drug for selected patients. We have to be careful with it because it actually works with brain chemistry in order for you to stop smoking. And when you fool around with Mother Nature and brain chemistry, look out. So we don't recommend alcohol with any medication, to be honest with you. So I'm not so sure this is new information, but if you are using Chantix and you drink, I would not drink.
I think the risk of seizure is very low. Certainly the risk of cancer and all the bad things of smoking is very high. Here the benefit of the amount of medication far outweighs the risk, and you can lay off the booze for a little while you're quitting smoking.
Absolutely.
Moving on, let's talk about more alcohol, or palcohol. Palcohol, which is a powdered alcohol that'll be coming to shelves soon, I believe this spring, is being felt to be a little risky for teens and people in recovery. Have you heard of this?
I have not heard of powdered alcohol, but you've piqued my interest. Tell me about it.
Powdered alcohol is actually a freeze-dried mixed drink. This is something that you could take to space. You know, we had space ice cream when we went to the Smithsonian. Well, now when you go to the bar outside the Smithsonian, you can get powdered alcohol or freeze-dried alcohol. They have margaritas and all different kinds of things. Comes in a small little packet, and they pack a punch. You just mix it with water. You don't have to mix it with anything else. The concern is, are kids going to sniff it? Are kids going to inject it? And it's so much easier to conceal into places we're not supposed to have alcohol.
Right. Now, will the grocery stores have this?
No, this will be at for us in Pennsylvania, the liquor store. For those of you who are watching in Jersey and across Texas, you'll have to check your local
7-Eleven.
So
moving right along. Palcohol, okay.
Alcohol, that's new. I'm kind of looking forward to giving it a try, but it doesn't sound great. They don't make a bourbon. So. Moving on, let's talk about blood pressure and, you know, blood pressure control, what kind of targets we want to see, when do we start treating, and then, you know, lately there's been a lot of talk about how we treat different age groups. Like I would treat myself pretty aggressively, but someone who's in their 80s, I may not treat as aggressively.
Right, exactly. And in the old age, when I was learning medicine, the first number was allowed to be 100 plus your age. That went by the books, and now we want your pressure as low as possible. Well, it turns out when you're elderly, and it's hard to define sometimes, higher might be better for you. In fact, we just had a patient in our office whose blood pressure was 120 over something. She was in her 70s, and she felt horrible, lightheaded, dizzy, falling, no energy. We cut back on her blood pressure medicine, and now her blood pressure is 100 plus her age. So we go back to that. And she's fine. She's doing housework and just loving it. So we may have to accept higher levels in our elderly. That's the take-home message.
Yeah, I agree. I think that I like to think of it as risk stratification. For someone my age, my goal is to get old, okay? And to do that, I have to keep my blood pressure real low. That 80-year-old, they already got to that goal. Now their goal is to live independently. And what's going to ruin that is a fall because they got lightheaded because I'm keeping their blood pressure around 110.
Yeah, that's a good point. The cure could be worse than the disease.
And so now they're saying that with our elderly individuals with not a ton of risk factors, we should be looking to keep their systolics less than 160. That's kind of wild because I treat 150.
Right, exactly.
Now speaking of, this is a really neat study. We're talking about we're now going to be lax with the blood pressure medications. But when we have these older patients come in and they have a small heart attack, what did we used to do?
Pray. Okay.
Well, we used to pray, but even now, we bring them in, we put them on nitrates, put them on aspirin, maybe Plavix.
Very aggressive.
And watch. Not very aggressive. At least it didn't think to be. Now it's actually, they're saying that there was a study done in Norway. They divided 2 groups out. One did what we just talked about. One went right to the cath lab. The people that went to the cath lab lived longer and lived a better life. The ones that we kind of treated conservatively, that we would never treat someone my age having that type of problem, but someone older we would. It turns out they'll have unstable angina within 6 months and become cardiac disabled.
Right, and I guess what they're talking about here is you have established disease in someone in which one of the wheels are falling off on the wagon, and rather than just tightening it up, I think the idea is let's just replace the wheel.
Yeah, exactly. Let's move on to something a little bit different. Talk about not necessarily a new medication, but a new style of giving medication. There's a medication called Spiriva, which is something we use for people who have COPD. It's one of the few medications for COPD that actually shows that we can preserve lung function and help these people live longer. So it's very important for us to all be on.
Now this is the old way of doing it. You had to take out this tablet.
Yeah.
Stick it in this doohickey.
Not there, but you got to put it in there.
Right, okay, drop it in.
Then you got to drop it in. Then what?
Crush it. You got to crush the tablet up, and then you inhale it, and it's a powder, and half the times it ended up on the roof of your mouth, and very cumbersome for a very important drug. But get a load of this high-tech.
You did it once a day, and the other thing is you had to really be able to take a big full breath in.
Yeah.
And if you don't have COPDers don't have a great inspiratory effort. Along comes the ResMat system. Now this is a pretty cool device that we turn, we unlock, we put it to our mouths, which I'm not going to do, and you just push the button and it mists out. It's almost like a nebulizer. You don't have to work hard to pull that in. You can just breathe in slowly, and you do it 2 shots a day.
Yeah,
that's it.
It's pretty impressive, and the way they made it is that you can't reload it until the cap is closed, and the cap covers the thing that discharges it. So you just twist it. It really is foolproof. You twist it. I don't know if you can see that puff of stuff come out, but there it is. Unbelievable.
Cool stuff.
It's really neat
great
stuff.
way to take a medication that's really important. Unfortunately, we did not have a great device or technology to get the medication. Much better way to take the drug. People are going to see a lot more benefit from it.
I think on Star Trek, was it?
Yeah, it's definitely.
Star
this
Trek
was inspired by Star Trek.
Yeah, no doubt. It's kind of neat.
Wasn't there plants that people walk by and then spoofed?
Yeah, that's right. Oh wait, McCoy lives. And speaking of living, we're going to continue our show after this brief commercial message. Make sure you stick with your healthcare provider, and remember that you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. I'm here with the Fipster, providing you blow-by-blow medical information, right?
We'll get on with the headlines.
Okay.
Alrighty. Systemic review finds that there is no proven benefits to early identification of cognitive impairment. This blows my mind.
Yeah, it is interesting. Now, let's just try to define this. We're not talking about mild memory impairment, because as we age, we sometimes have issues with memory. We're talking about cognitive impairment, which is mainly changes in personality, behavior, and early stages of a dementing illness, correct?
Right, but not Alzheimer's. And
right, not
people
Alzheimer's.
with what's called MCI or mild cognitive impairment, they can progress to Alzheimer's, but they don't necessarily. Sometimes they can stay there. And I would always thought knowing these things, especially with Alzheimer's, knowing early you can get on the medications and slow the progression. But it turns out with cognitive impairment, getting on medications doesn't really change the way it's going to progress. If it's going to progress, it's going to progress.
That's
to
right.
Whatever it is.
Right, so we go back to, eat, drink, and be merry. And so sometimes we can affect diseases, and this is one we can't.
All righty, let's move on. It's kind of staying in that same vein.
Right.
The FDA approved a brain imaging drug called Vizamyl, which is used to diagnose Alzheimer's early.
Yeah, tell me a little bit about this. I'm really not familiar with it.
Well, so far what do, we send people for an MRI to make sure there isn't anything else going on, but an MRI will never tell us someone has Alzheimer's. Sometimes with a PET scan or a positron emission tomography, it's a test where we inject radioactively labeled glucose and we can see changes in the brain and the way it's working. We usually use PET scanning to look for cancers or tumors. Well, Vizamyl is a medication or a radioactively labeled drug that will attach to the amyloid plaques that are seen distinctly in Alzheimer's and not like diffuse Lewy body disease and the other type of vascular dementias.
Right, and it's those amyloid plaques, kind of like gum, that are gumming up our neurons in our head and having us have the Alzheimer's illness.
All right, let's move on to some different type of topics, some a little bit more acute care. You know, go back to your St. Joe's ER days. Now, a guy walks in 2 weeks ago, his friend's dog bit him, and now he has a pretty red swollen hand. He's got some streaking going up the arm. His fever about 100.
Yeah, dog bites, of course, we were always told the human bite is worse than a dog bite. But of course, we're seeing more and more dog bites these days. I'm not sure exactly why, but nevertheless, somebody like this has an infection, and we'd probably admit them to the hospital, culture them up, start them on antibiotics, tetanus shots, things along those lines.
Yeah, cat bites obviously are some of the worst things to get bit by or bitten by. But however, dog bites, especially left go, with the increasing prevalence of MRSA, you know, just in general, it makes these bites a lot harder to treat, and you really have to get on top of them quick.
Right. You know, and that's an interesting point is, you know, in the olden days, you used to get away with over-the-counter antibiotics, but the bugs have gotten smarter, and so we need to keep ahead of them and be aggressive with some of these soft tissue infections.
Let's move back to some blood pressure management. And before we talk about the elderly and where we want to keep their pressure, but you know, a lot of questions, some people will come in with a number that's a little on the high side. Maybe they're 140 over 80, they're 150 over 90, and they're wondering, gee, should I go on blood pressure medication?
The answer is yes. We've have revised the idea of when to treat hypertension. And there's a special category which a lot of people fall into called pre-hypertension. They're not there yet, but they're going to get there, especially if they have a family history. Obviously, we would like to try lifestyle modification, sodium, licorice, watch the weight, things along those lines. But ultimately, I think if you're close, you're going to need treatment. And the treatment will put you on a better curve of life, if you will, and lower risk factors for stroke and heart attack and things along those lines.
Yeah, I think lifestyle modification is important because it'll help. It's not going to help me decide. For some people, I'll say, oh, I'll give you a month, let's see what you can do. But most people are going to need some type of medication, and then maybe the lifestyle modification will cut down on how much of that medication I may need. You know, certainly cutting down on the salt. You know, the DASH diet, they recommend less than 4 grams of sodium. Well, that's a fair amount of sodium. If you cut up to less than 2 grams, you can lower your pressure significantly. You cut it down to less than a gram, not only do you lower your pressure, but you also lower your cardiovascular risk.
There's no doubt. And you know, people have in their glove compartment a thing to check their tire pressure, and everybody's worried about tires wearing out prematurely and taking care of their tires. I'm sure those people don't have a blood pressure machine at home, and that is a crucial, vital sign to have. And it's more important what your pressure is at home. So for Mother's Day or Father's Day, for loved ones, get them a blood pressure machine. And if you don't know how to use it, bring it into us, and we'll show you how to use it and sort of calibrate it to make sure we can believe these numbers. And I think that that's a true thing that you can do to help a loved one see their next decade.
You know, they just did a study not that long ago about exercise and blood pressure, and I think exercise is important, but you have to be careful. If you're doing some pretty hard cardiovascular exercise and your pressure's not controlled, that can really make your pressure go crazy. But they did just do a study showing isometric exercises, which are exercises that are more static type things where you're just kind of holding and flexing muscles. You're not really moving weight per se, but they're actually, you can see in your systolic a drop of about 8 points and your diastolic a drop of about 3-4 points. Again, not a huge drop, but enough that will help us kind of like not have to add on second or third medications or increase the doses of meds.
Yeah, no doubt. And we kind of fall back on aerobic versus anaerobic. The aerobic exercises are the huff and puff ones, and they're probably the best you can do. The ones where you have to close your mouth and grunt, I think that they have more issues with them. Would you say so?
It all depends on the intensity, I think. That's what gets people in trouble. You know, people, you know, typically want to be, you know, real hardcore and go in and do it like they did in their 20s, and that's just, you know, that's not really feasible when you're older. And so it's good to go low and go slow.
I'm a huff and puff guy, but that's just me. So, but pressure is truly important, and I think it's something you have to keep an eye on. It is truly an important vital sign, and again, I would encourage people to get a blood pressure machine out there. Is there anything else we need to tell?
Well, you need to tell them that it's your health again, and it will be in the next segment.
There it is. He did it for us. We'll be right back. Last segment of earth-breaking, ground-shaking news here, Phil. So let's start it off.
We'll get 2 more headlines in. The quest for an HIV vaccine is slowly moving forward.
Yeah, that's pretty impressive. And of course, when I was at St. Joe's mentioning that, probably 25 years ago, we had our very first case of a patient came in from New York, from Hazleton, but he was visiting in New York, and he had this anemia, fever, weight loss, and the late Paul Rhoda, hematologist, and I worked on him together. And he was the first case of HIV, believe it or not. Hard to believe. And of course, since then, it's become more commonplace. We really didn't know what it was at that point in time, but eventually figured it out.
Yeah, 25 years ago, people died from HIV. Today, with the meds we have, it's really actually pretty rare to see someone die. The problem is HIV is such a mobile virus. It's able to mutate. It has a very broad, diverse defense mechanism against a lot of different of our immune systems. So it's hard to teach our immune systems how to beat this. But there's been some promising vaccines that have shown to at least help some of the immunity problems. But I think we're getting closer. So
Yeah.
that's certainly going to help us here on home turf and abroad.
No doubt, no doubt.
Moving on, let's talk about CAC scoring, or coronary artery calcium scoring.
How about that? This is from CAT scan imaging you're referring to?
From a special type of CAT scanner.
Okay.
It's coronary artery calcium scoring is a test that we can do that unfortunately insurances don't cover, but it's about maybe $100 to $200 that is able to tell us how much calcium deposits there are in the arteries we have. Now, it doesn't actually look for blockages. That's a special type of CT scan. We don't do it in this area, but it is available down in the Allentown area. It might have been available in the Wilkes-Barre area too, but I'm not sure. What this really tells us is it helps identify risk. You know, if I have a patient that comes in and their cholesterol's up a little bit, they have some risk factors for stroke and heart attack, but they really just don't want to take a statin, but they want to get serious about their heart. What we can sometimes do is actually send them for this test, and this will help tell us how serious we need to be. And it's a relatively low radiation test because it's a short test. It's not like coronary angiography where we have to slow the heart down and then it's a long, big test where you really get a lot of radiation. I think in a certain subset of patients it's a useful test, or they could just take their statin.
Sure. And it's funny you mention that because they did a study that if given the choice, believe it or not, of a longer life or taking a pill every day, they are not going to take the pill every day. I mean, for some reason, I can understand that to some extent, but if I can give you a pill that's going to lower your risk without gigantic side effects, lower your risk of badness for the future, I mean, it's sort of a no-brainer. And I think that's sometimes a decision tree that we get caught in. I'm asking you to take a pill for a disease or something you have no symptoms for. So why would you want to do that?
Yeah,
And
that's
so,
a big problem.
So if we can prove to someone, hey, listen, you got these calcium deposits, and if we lower your LDL and bad cholesterol, these things might shrink up a little bit. Hey, that's where it's at.
Again, it's all about risk management, and there's actually tools. People will ask me, well, why are you using your cell phone here in the office? I actually keep on my cell phone now, and I have an app that will help me actually identify a percentage for what someone's 10-year risk is for a cardiovascular related death. And it takes very simple information, and it takes male or female, your age, some cholesterol parameters, your blood pressure, whether or not you have high blood pressure and you're treated, you're diabetic or smoker, and I can come up with those risks. And so 55-year-old, cholesterol total's not too bad, but his HDL is pretty low. His blood pressure's up a little bit, but he doesn't take anything for it. He smokes, he's not a diabetic. His 10-year risk is 14.2%. Now, if that guy quit smoking, his risk would drop down to 7.7. If he was a diabetic, his risk is 25.
Yeah, it is truly about numbers. And when you're talking coronary disease, stroke, and heart attack, it's kind of like a piece of a puzzle. The more pieces you have that add to the risk, your risk is really going to double, if not triple. And just for fairness and transparency, if you will, my risk was what, in the 6 range, I think?
Yours was 6.7%.
6.7%. And so we kind of used it to see if I'm going to be around next year. So bring on that Easter pie. We'll
You're
be
ready.
here.
It's not going up.
We
so.
can have it.
All right, we spoke about diabetes. There's been some new devices in diabetes, and diabetes, the market and the industry is really trying to make things simple for patients, and so they've come out with a number of new things. And Lately, the big push is for this type of medication called a GLP-1, or a glucagon-like peptide medication that helps actually reverse some diabetic things in the pancreas. It's one of the better medications out. It is injectable. They don't make an oral. We can't get around that. It used to be a shot twice a day. Then a company came out with a shot once a day. Then a company came out with a shot once a week.
It's a week, wow.
Then other companies came out with better shots once a week. So I actually brought the devices in so we can kind of go over the differences between all of them.
Let's take a look.
Let's take a look.
Before we get into the injectables, keep in mind the Farxiga, Invokana, these are really newer agents that make you pee out sugar. Patients will pee out about 2 candy bars a day of sugar. It stops the kidney from absorbing glucose, and they virtually all lose weight. It's unbelievable. I've just been so amazed with this drug, but this is something different.
This is something different, and this has been around a longer time. It actually is able to show that it's able to reduce some of the complications related to diabetes. These other medications he's talking about, I think they're great for select individuals, but there's a couple people they may not be good for, and so you have to pick that right person. Okay, let's talk about the first device. So here's the first device.
Rather bulky.
It looks like a Roman candle. But
So what you had to do with this device is you had to first twist it, and they all require some twisting, okay? Then you had to put on this big bulky needle, which I have to tell you is not a very friendly needle. I'm not a huge fan of this device. Wow. Big needle, okay? We're not done yet. Then you had to twist it some more, and then you had to mix it, and then you had to mix it, and then you mix it for a little while.
Okay.
You actually have to let that thing mix that like 60 times.
wow.
Okay?
This is not user-friendly.
And then when you're done, push it in, count to 10, you're done. That's your week, okay? First device to come out.
All right.
So next company comes out a little bit better, a little bit smaller, seems easier. First, we twist from 1 to 2. Once we hit 2, this has to sit now for 15 minutes.
Wow.
You got to get a turkey timer or whatever and let it sit for 15 minutes. Now the needle is smaller, and we pop our needle on. Oops, I dropped the needle. Say it's still on there. We twist it, shoot it, okay? What's neat, these two things, you're both injecting yourself, okay? Then Trulicity came out, okay? Trulicity is the newest one. It's once a week. And a lot of people hate the idea that they have to give themselves a needle. The needle is already in there. You can't even see it.
I like that.
So all you have to do is you have to unlock it. No needle. Put it to your skin, pop. Wait, it unpops on its own, and it's done. There's no needle. This can be thrown away in the regular trash because there's no exposed needle for your garbage guy to get poked by. It's a all-in-one contained unit.
No twisting and mixing.
No twisting, and I mean, some people like the mixing, I think, but others don't. And it's just a real one-stop shop, quick way.
Trulicity.
Trulicity.
Right.
I'll show you that. We'll have a picture of the box. Something worth looking into.
Yeah, and then once a week?
Once a week.
Once a week, wow, to control your diabetes. Well, I don't know about you, I'm exhausted.
As fast as that injection was, that's how fast the show went.
There we go. Thank you for joining us, allowing us to come into your homes, inform, and hopefully entertain you. Remember, you're watching It's Your Health, your leader in healthcare information. Thank you.